topic I am discussing is forensic psychiatry and there will be questions from it. Forensic psychiatry থেকে দুটো কি তিনটে কোশ্চেন থাকে নরমালি এক্সামে হয়তো একটা দুটো আসবে বাট ডেফিনেটলি देयर উইল বি কোশ্চেনস ভাইভাতে থাকবে এমনকি থিওরিতেও থাকতে পারে সো দি মোস্ট ইম্পর্টেন্ট পার্ট ইন থিওরি is this 3 to 4 laws. Okay, so it may sound similar. On this basis the justice is being done. So these laws, there are subtle changes. ठीक है, Durham's law, then there is Curran's and there is McNaughton's. Okay, so among them Durham's. Okay, what is Durham's law? See here, an accused person is not responsible for his crimes. Why? Because it was the product of disease or mental defect. So this is also known as the law of product. Okay, the product law. Product of mental disease or defect. So if examiner asks you, you should state that particular term that is known as product of mental disease or defect. Other things are same. So what does that mean? It means that if in case a subject has some mental disease or anything, any minor problem in their evaluation, in psychiatric evaluation, then they may be excused. Okay, they will not be punished. তাহলে কি হচ্ছে যে সাধারণ ছোটখাটো এমনি যেমন কেউ বললো আমি সাইকোপ্যাথ কি সোশিওপ্যাথ কি কাউরি অ্যালকোহলের জন্য what do you call addiction আছে, they will take the plea that due to alcoholism and all they are of unsound mind and they have committed the crime. So this law has the biggest fallacy that it means covers everything, and due to which the criminals they take the benefit of it. Okay, so Durham's law had a very big flaw that it included every psychiatric problem, due to which the criminals were easily released. They couldn't be punished. So everything was dependent upon the psychiatrist. Whatever the psychiatrist will say that the subject is of sound mind or not, they have to be released. Okay, so Durham's law, there was the biggest policy is that it included everything, because the term itself is a product of mental disease or defect. So it is a very big term which will include everything, and later on leading to the what happens, the criminal will be excused. Okay, because it includes everything. So later on this was replaced by Curran's. Durham se gelo tarpore Curran's elo. So Curran's, what you have to remember is, everything is same, but capacity to regulate his conduct. C for Curran's, C for capacity, C for conduct. So all these letters you should remember as mnemonic. Capacity to regulate his conduct. So a person won't be responsible for his crime if the person is of unsound mind. A unsoundness এর জন্য he is not able to, he doesn't have the capacity to conduct, ঠিক আছে, he is unable to regulate his conduct. So the Curran's law states the capacity unable to regulate his conduct. তার মানে কি, a person may be knowing that what he is doing is right or wrong, but still the person knows that what he is doing is wrong, but still he is unable to control his conduct. যা করছি আমি ভুল করছি জানছে, বুঝতে পারছে, but still he is unable to control his act. So this currents law includes what? All those impulse disorders. Impulse disorder কি ছিল? Kleptomania, pyromania, তাই তো? So all these manias were included. Obsessive compulsive disorder. So if the subject, if he knows that what he is doing is wrong, but still is unable to control his act, that was included in currents law. Okay, fine. So here you can go through it, what I just explained. Okay, পড়লে next. So now let's come to Mental Health Act. Previously I just gave you a blueprint about Mental Health Act, but I didn't explain what it includes and how it functions. So today we have time, we'll go in little bit of details, okay, so that you can write in exam. If you can't understand, you have to mug up, and if you mug up, you will be confused and you will write the wrong answer. So I will explain what is what, and you should go through it. You should bear with me, okay? So few terms. In Mental Health Act, asylum is substituted with psychiatric hospital, lunatic with mentally ill person, and criminal lunatic is criminally ill prisoner. Okay, these are the terms that has been substituted. Then who is a mentally ill person and all, you can find in any other books, but now we'll go to the most important part. That is how the psychiatric hospital, what are the regulations of psychiatric hospital? Okay, psychiatric hospital is psychiatric patients, how they get admitted and how they are released. What are the rules and guidelines that are regulating it? Okay, তাহলে think of a scenario. একটা পাগল এলো, okay, in one mentally ill person has come with a complaint that his relatives are complaining, not the mentally ill person, that he is committing nuisance in the neighborhood. এটা ভেঙে দিচ্ছে, ওটা ভেঙে দিচ্ছে, কিছুতে শুনছে না. All right, so what will you do? So the relative, supposedly the wife brings the husband to your clinic, okay, or you are the doctor at the hospital and they have come to you. So how will you approach? Ha ki korbe? Normally what they do is they refer to the psychiatric OPD, okay, but suppose you are at your clinic and there is no psychiatrist available, so what you will do? কি করবে? There are certain scenarios, okay. So in case the first scenario is immediate restraint. Immediate restraint মানে কি হচ্ছে? You have to restrain the subject so that he is not harmful to himself or harmful to the society. ঠিক আছে? So he is not danger to himself or danger to the society. That includes the immediate restraint. So immediate restraint normally you take the consent of the relative. Okay. So consent of the relative is important, but in case the consent is not available, then also they can be restrained. Okay. They can be restrained until the until he is not safe. Mane he is not danger to himself or danger to the society. Until he calms down. Until that period, you can restrain him. So restrain kothay korbe? Normally he will be restrained in a room where there will be attendant observing him. Okay. Not like they will be tied with hands, haath bende dilam, pa bende dilam, not like that. Okay. And you can give some sedatives. So that is immediate restraint. Tale immediate restraint e ki duto clause ache? Period. Period is until he is not danger to others, he can be restrained. Akbar, when he calms down, he has to be released. That is immediate restraint. Here consent may be taken or consent may not be taken. Okay. Second scenario, admission in a psychiatric hospital. So admission in a psychiatrist hospital, it can be of, first is voluntary admission. Voluntary admission means the subject himself approaches to the psychiatric hospital and wants to get admitted. So in this case, the subject has to be a major, more than 18 years of age. And if he is a minor, then his guardian should accompany. Fine? So that is about voluntary admission. Okay. Second is under special circumstances. Under special circumstances, here there is an important thing. Relatives will decide whether to get him admitted or not. So the relatives will, what they will do? What are the important clause for it? First, the relatives should fill up the forms. There are many forms. Form 4, Form 5, Form 6. Many forms are there. So one has to fill up the forms, and there are two main prerequisites. First of all, he has to get the patient checked up from two doctors. One of them should be a government doctor and another should be any other doctor, and both preferably a psychiatrist. Okay. And both doctors should have examined within 10 days of period. 10 দিনের মধ্যে দুজন ডাক্তার দেখবে, তার প্রেসক্রিপশনে লেখা থাকতে হবে যে সে এই ডিজিজে, এই মেন্টাল ডিজিজে আছে. So the subject is suffering from such and such disease, and both doctors should be agreeing to it within the time frame of 10 days. Okay. So these are the two prerequisites. Two medical practitioners within 10 days. Alright. So in this case, the subject can be admitted till 90 days time frame. Mane 90 days porjonto admit kora jete pare. After 90 days, if in case the period should be prolonged, then the hospital or the relatives may approach the court, that is to the magistrate. So from the magistrate they may again take permission for continuing of the stay period. Okay. So involuntary admission till 90 days. Okay, clear? When if the relatives, they want the subject to get admitted. This is one scenario. Now we'll talk to another scenario. Reception order on application. So here it states same, but there is another thing, that is the doctor. If in case the doctor thinks, the attending doctor thinks that the subject should be subject should be admitted. In that case, he should form a board comprising of two doctors, okay, in that same hospital. And if both the doctors agree to it that the subject is suffering from the same disease and should be admitted, so shall be. Okay. And this can be continued till 6 months. After 6 months, again the doctor, if thinks the term should be prolonged, should approach to the magistrate. So here in mental hospital, in general scenario also, the doctors or the patients has to visit the magistrate. Okay, it's a common. Why magistrate? Because magistrate is third party, a unbiased person, okay, or entity. So in case there is a feud, so the magistrate will intervene. So all these rules and regulation are based on how it functions. So in case all these psychiatric hospitals, এই যে যত psychiatric hospital, asylum এগুলো যেগুলো আছে, এগুলোর একটা governing body আছে. Okay, there is a governing body or regulating body. So they have formed a committee. Okay, so there are normally 5 persons, 5 visitors. Okay, 5 visitors who can go to the psychiatric hospital emergency check এর জন্য যেতে পারে. So 5 visitors এর মধ্যে there should be 1 doctor, 2 social workers and other people. Okay, so the doctor should be a psychiatrist. So according to the authority, এরা এই যে 5 person যে team, they can visit any psychiatric hospital anytime. Okay, for inspection. Okay, that's clear. So everything is regulated. Can regulated? Because there was previously abuse of this field. কাউকে পাগল বলে ভর্তি করে দিত, ঠিক আছে? There were previously no such regulations made, but now these are made so that the mentally ill persons are benefited from it. So thus came the Mental Health Act. Okay, that is the history of it, for the betterment of the psychiatric patient. So all the committee, কি করে? They regulate everything. They inspect the psychiatric hospital and all. Okay, so this part I explained, right? RMP and government practitioner and all. Okay, another thing is that if in case the relative mane near relatives, husband or wife, if they are not available, husband and wife is not available, so their nearest relative would be, you can apply. So but they have to give in written to the magistrate why their nearest relative didn't apply and they have applied. বোঝা গেল না? ধরো কাউরি বউ কিংবা হাজব্যান্ড did not apply, মানে the person is so mentally ill that the wife or husband couldn't approach due to certain scenario. So their neighbors may apply on behalf of the husband or wife, but they have to give in written why wife and husband did not apply. বোঝা গেল? So why such need? Because it has previously found that people, mane somebody had some property issue or dispute. Okay, so the person who he didn't get the property, okay, he might be having some what do you call, uh, some revenge attitude towards the person. So he can apply that that person is mentally ill. Okay. To avoid all those scenarios, such framework has been made. Fine. So the relative, whoever is it, he should also have seen the patient within 14 days. এই না যে আমি এক বছর আগে দেখেছিলাম সেই রকম পাগল ছিল। Within 14 days of period, they should have seen the subject. Maybe he may be husband, he may be wife, or he may be the neighbors or relatives. Okay, far relatives. So first preference is for the husband or wife or father or mother. Then only court will listen to other people whether whether they should take the application from that subject or not. And the application should have all these parameters. Kiki parameter? Form should be filled up and the subject should have been inspected within 10 days of period by 2 doctors. One of them being a government doctor. Okay. So another scenario. So you in government hospitals and all, there are few wandering people. ওই হসপিটালের আশেপাশে ঘুরে বেড়ায়, ঠিক আছে? So those persons can be arrested by the police and should be brought to the magistrate. Okay. Now magistrate will decide what to do. So what he will do is, magistrate will order the patient to be seen by a psychiatrist, to be evaluated by a psychiatrist. So psychiatrist, what he will do? He will attend the patient. Okay. So as we know, in the first sitting, we cannot diagnose a patient, right? First sitting e kono diagnosis hoy na psychiatric cases e. So the subject should be admitted. Okay. So admission koto diner hote pare? 10 days. So the psychiatrist can admit the person for 10 days to observe him. Again he may repeat it for another 10 days and again another 10 days till 30 days max 30 days. So what will you do? The psychiatrist may admit the patient for observation for 10 days. Basic scenario. Now that is one way of admission. After observation and all, they can come to a diagnosis, and later on they will deal what they have to do. Understood all this? Now there are few scenarios. There is mentally ill person and mentally ill prisoner. Mentally ill person is different from mentally ill prisoner. Okay. So in such scenarios, most of the things are dealt by the magistrate. Magistrate will decide what to do and what not by advice of the psychiatrist. Okay. The mentally ill prisoner cannot be released in the society. যেমন তেমন করে ছেড়ে দেওয়া যাবে না, সে তো আবার গিয়ে কাউকে মেরে দিয়ে চলে আসবে। So these mentally ill prisoners are dealt by the magistrate by advice of the psychiatrist. কি পরিস্থিতি আছে, whether to admit him, whether not to admit him, everything the magistrate will decide with advice of the psychiatrist. There is another scenario. Suppose a mentally ill person was advised for psychiatric admission. ঠিক আছে? But the relative may approach the court magistrate and say that, sir, please don't admit him in the hospital. I will take care of the patient. So in that case, the relative may submit a bond in court and take the relative home, means mental ill person home, and get him treated. So the bond is in মানে বন্ডে করে নিয়ে যেতে পারে, ঠিক আছে, বন্ড দিয়ে। ওকে, সো হোয়াট ইজ রিসেপশন অর্ডার? বিয়ের রিসেপশন তো না, রিসেপশন কেন বলা হচ্ছে? nobody has asked. So reception order is more favorable term than giving an just a order, ঠিক আছে? So reception term is a more sober term. Actually it is order by court. Okay, reception order means admission order. In a means legal way te dekhte gele it is a admission order. Jail ki hoy? What is jail? Prison. There this the magistrate orders this order যে এই ক্রাইমের জন্য তোমার এটা পানিশমেন্ট হলো। ওকে, they give a verdict here. So such harsh terms are changed with some sober terms. Reception order. Okay, now comes the third part. পাগল এলো, পাগলকে ভর্তি করলাম, এবার পাগলকে ছাড়তে তো হবে, ডিসচার্জ করতে হবে। So in cases of voluntary psychiatric patients, voluntary mentally ill persons, they can be released within 24 hours. Voluntary jara. Okay, any other scenarios like application থেকে যেটা হলো, in those scenarios the psychiatrist will decide when to release and not, but there will be normally a board. At least 2 doctors will decide so whether to release the patient or not. Okay, recommendation of 2 doctors. Fine. And any application যেগুলো অ্যাপ্লিকেশনে ভর্তি হয়েছে, so such subjects the doctor should send a copy to the applicant that they are releasing the subject. Okay, that is a very important part. যে application করেছিল, the application could be or the order could be from the court side or from the application could be from the relative side. So they have to be informed that we are releasing the patient because they have to take the handover. Patient admit হলো, patient কে আবার ছাড়লে আবার handover দিতে হবে যে হ্যাঁ আমি তোমার patient কে ছেড়ে দিলাম, এবারে আপনার দায়িত্ব। Fine. So while discharge, the information should be given to the applicant or to the court that the subject is being released. But in case of mentally ill prisoner, the scenario will not be same. এখানে everything should be communicated with the magistrate or the court. Fine. See, copy of discharge to be sent to whose reception order he was admitted. Very important. All right, all these things I have discussed. All right, so this part means mental illness part we have covered, mental health act we have covered, and forensic psychiatry is over. So can you answer few questions? मैंने एकदम सोजा क्वेश्चन जिज्ञेस को, illusion की, what is illusion? False perception. Okay, misinterpretation of perception or false perception. What is delusion? False firm belief, right? Okay, what is delirium? So all these terms, while you appear for Viva, you should be familiar with delusion, illusion, hallucination, all these things with examples. Fine. Then you should read about insanity, feigned insanity, malingering, what is malingering. Alright. All these terms you should know. McNaughton's rule, Curran's rule, Durham's rule. Then all those manias, klepto, pyro, all those manias, obsessive compulsive disorders. Right. Pyromania is পোড়াতে ভালোবাসে, arson যেটাকে বলা হয়. So they like to burn other people's house, they all like to burn anything. So that is pyromania. Pyro means fire. Pyre means fire. Okay. And pyromania, dipsomania, kleptomania, many things are there. So what is body stuffer and what is body packer? It is a part of toxicology. Hint. Body stuffer, body packer. So this kind of questions may come in your theory, part of syllabus, but these are terminology mostly. So এরকম করে directly question দিতে পারে ছোট, write about body stuffers or body packers. So what are they? They are, what is body stuffer? Body stuffer কারা? যারা smuggling করে drugs. So they normally what they do is they consume the drug by putting them in packets. They swallow it and they try to smuggle it. Right? Those are body stuffers. Right? বোঝা গেল? And there are body packers also, similar only. To avoid detention by police, they try to destroy the drugs and all by various means. So body stuffers, normally they consume it or they can insert it in their any openings, orally or anally or vaginally, anywhere. They try to smuggle. বোঝা গেল? All right. Now we come to few miscellaneous topics. Do tinte. I will go through verificatory body who controls how and where and who should conduct the transplantation. কে করবে, কোথায় করবে আর কি কি রেগুলেশন ফলো করে করবে. There is an authority. Okay, they have formed an authorization committee and they control it. Okay. So regarding the authority, they provide license to the hospitals whether they can undergo, means they can perform a transplantation or not. And this set of rules, if they don't follow, then their what you call registration may be cancelled. That hospital's registration may be cancelled if they do not follow those rules and regulation, and they may be punished. Okay. So this authority, they have the power of the civil code. Okay. So what are the rules and regulations? So is it visible? No, not visible. Okay. So what is the main goal of this act? এই অ্যাক্টের মেন গোলটা কি? To stop illegal harvesting of organs and illegal, what do you call, commercialization of the process. So they are regulating it so that the organs and all are not sold in the market for money other than the therapeutical purpose. The main purpose is organ harvesting and organ transplantation and all should be for therapeutic purpose, not for commercial purpose. So the organs that are being transplanted should not be misused. মানে ওটা বিক্রি করা চলবে না. So normally this act enforces that the near relatives, almost near relatives or related blood related subjects can donate organs to their family members or somebody. Okay, so they want to stop the commercialization. So whom can they donate? Whom can they donate? কাকে donate করতে পারে? First of all, there is live donation and after death donation. ঠিক আছে? Live কোন কোন অর্গানের লাইভ হয়? কিডনি হতে পারে, লিভার মেবি, আর লাইভ. So after death, what organs can be donated? Cornea, heart, right? And what else? Liver also. Okay. So in case of life, মানে live subject যখন donate করছে, then it is regulated that it should be donated to the nearest relative, near relatives, those who are related. But still there is a scenario where other person can donate by the approval of a committee. If the committee approves that yes, that so and so person can donate to this person, they can donate. Okay, otherwise it is a rule that only a near relative can donate. You cannot purchase from anywhere else the organs, or you have to wait for a waiting period. যে কোনো ব্যাংক থাকে organ bank, there will be a list according to priority. You have to wait for the organs. That is normal way, but it will take a long time, so that they ask for near relatives to give. Fine. So matching is done and all of that you will have read in other subjects, but we'll deal with the legal part. Bone marrow transplant, does it fall in this act? It doesn't fall. Okay. So what are the things that fall in this act? These are the organs by the definition, for the definition of মানে এই অ্যাক্টের জন্য কি ডেফিনেশন আছে অর্গানসের? What falls under it is the organs, মানে the cell or tissue which if taken out will not regenerate itself. So for this act, that is the definition of an organ. All right, that cannot regenerate. Kidney, will it regenerate? No, it will not regenerate. Heart, will it regenerate? It will not regenerate. So that those organs, means those tissues which do not regenerate, falls under this purview. Bone marrow, it doesn't fall. All right. So who can donate? Kara donate korte pare? Normally any person can donate, and the government is encouraging for those purposes. For that you have to give your consent. You have to fill up forms that I want to donate my organs after death. Okay, but still there is a scenario where, means the law, according to law, you have given consent, okay, that my organ should be donated. But after you die, your body belongs to your family. Okay, your guardians, all right, or your what do you call legal heirs. They are now owner of the body. If they don't want to give the organs for donation, they may not, because it is their property now. The body is their property now. All right. So consent of yours is needed, but your guardian's permission is also needed. Right? बुझे गए? Other things, what is stated here is the regulations, how and how to control it, regulate it, why license may be suspended and all. All these are there in this act, but you can go through it at your home. We don't have time for it for discussion at right now. Okay. Now we come to another topic. So in exam, such topics may come. That's why I am just giving a view that you can write in your exam. Directly হয়তো বলে দিতে পারে যে write about organ transplantation act or mental health act or PCPNDT act. Okay, all these may come in exam to write brief notes about it. So you should go through in your exam. So this is very common. You may have in your obs gynae cycle this might have been taught. PCPNDT, preconception, prenatal diagnostic prohibition. Okay. So, what is the goal? Means aim for this act? For prevention of gender discrimination. Gender discrimination করে abortion যাতে না হয় সেই জন্য একটা করা হয়েছে PCPND, so that the gender may not be revealed in anyhow. Okay. So, certain scenarios that I have given here where the one can perform, one can what do you call conduct the techniques are these six of them here. In case of chromosomal abnormalities, in case of genetic metabolic disease, hemoglobinopathies, any disorder where the life of the baby, okay, life of the child is endangered, in those scenarios one can go for the techniques. Okay. Otherwise, it is prohibited. So, the question may come in which scenarios PCPNDT Act can be bypassed. So, in these scenarios. Alright, you should state all this. Other than that, you can write like what are the all the registered practitioner has to follow this act, all the clinics institution has to follow this act. Nobody can advertise about what you call gender revealing techniques and all, USG and all the centers, counseling centers, everywhere one has to what do you call put a notice that what do you call gender discrimination is not being conducted here. এরকম সব জায়গায় এগুলো লাগাতে হয়. All these things we have to write. All right. All right. Now coming another topic, that is biomedical waste management. This is also sometimes asked. So you can read it in your অন্য সময় বাড়িতে গিয়ে পড়বে ওটা biomedical waste management. কি কি আছে, কোন কি কালারের কন্টেইনার থাকে, কোনগুলো বা আছে, কোনটা হ্যাজার্ডিয়াস, কোনটা নন infectious, all those. General chemical types of waste and how do you how do you eliminate it, all those things you have to mention in it. In general, types of waste, then comes whether infectious, non-infectious, hazardous, and what are the containers, black, blue, red, white. Okay, which container we will put what, that you should be able to write. Alright, that will come under it. And how to dispose of it, that is by autoclaving or incineration and all. That are incineration, autoclaving, microwave, okay, or dumping, anything could be there. So this you have to write if in case biomedical waste management is being asked.